11:30. Also, just looking at the COVID stats for the UK yesterday, just over 2,000 new cases and 6 deaths, which is a not insignificant number, of course, to all those affected, but a low number. And we are definitely on a really positive trajectory when it comes to hospitalisations and declining deaths from this illness. But there are still many, many people, in fact, potentially over 1 million people living with the symptoms of COVID, described as long COVID. And this morning we've been looking at what help has been available for those whose symptoms have lasted, in some cases, for months after they first became infected. We have been given at 5 Live Breakfast exclusive access to the long COVID clinic at Croydon Hospital. Our reporter Jim Reid went to a physio class and spoke to Zaz, hospitalised in March last year, on the ward where he worked as a doctor, and he's still suffering from symptoms more than 12 months on.
I came out of ITU, I think on the 14th of April, and I discharged 2 days later, which in hindsight was too soon, so I wasn't able to walk or stand, so you had to just learn to do that again with the physios while you're in hospital, and it can take time.
So talk us through the recovery process from that stage and how it's been for you over the last year.
It was, for me, up until September, I thought, things are going fine. I think within a couple of months I'll be there. So for work, you'll talk to them and say, yeah, I should be back within a couple of months. But in September, kids went back to school. Some kids go back and they catch colds. I caught it from them, which as parents you almost always do. And it completely wiped me out. You're so tired, you wake up in the morning and there are days where you just struggle just to get up. So the fatigue was a big thing. And then I started developing the brain fog. The brain fog is a bizarre kind of thing where, for me, it was not being able to find words, not being able to speak. And each time it just gets further back. You think, actually, so I'm getting better, and then you'll get something else.
Good, nice and gentle, going at your own pace, okay?
So it sounds like what you're saying is this is a condition that is not just impacting your health itself, but almost the quality of life, of your life in general.
Completely. I'm a year on now, so I have no income coming in. So financially, you're in a difficult state. And these are things that you don't consider. And as a man, yes, of course, we're living in a state where everybody's equal, but you still feel that this is my family. I have a responsibility. I should be looking after them instead of being almost a burden. And sorry, it's just sorry, just have some water.
So for you, Zaz, it feels like part of this has been that not knowing what the end is, not knowing how this condition is going to change, how it's going to progress. Do you still feel like that 1 year on?
No, absolutely, because I know there's nothing anybody can say. The truth is that we don't know. We don't know what's going to happen. We don't know what's going to happen medium term or longer term. We have an idea because of other viruses, other illnesses like this, but this is so unique in so many different ways. And these people who are working so hard to try and get me back to having a life now, which is more than just just being stuck at home. For me, the end point would be actually just to be able to get back to work, to be able to just play with my kids. I mean, and I say frustration, demoralization, all these words all the time, but just not being able to play with your kids, just like to that time when you just can't pick them up, It may take time. Different people are taking different times for recover, but people are recovering, and so that's what I'm holding on to. So there's still the hope that, you can come out of it having gained new insights.
Well, that was Zaz speaking to Jim Reid, our health reporter. Sasha Pearce is a physio and an NHS manager and a mum of 2 suffering with long COVID for over a year. Hi, Sasha.
Hello.
Did you understand a lot of what Zaz was talking about there, in particular this yearning just to having his life back?
Absolutely. I was just listening and nodding, and yes, it is that sense of whether I'm ever going to be the person I was before. I don't think I was as badly affected as Zaz was. I wasn't I wasn't admitted, but I had what they describe as the multi-system version. So I had lots of things going on with me that nobody could explain, and I'm left with a number of symptoms that, although I gradually improve, it's really affected my life and what I can do. I was a very active person before this. In fact, I was a competitive ballroom dancer. I can't even begin to think about getting back to dancing now.
And as we know, the severity of the original illness doesn't necessarily determine how challenging the long COVID symptoms will be. In fact, it often works the other way round. You can have the original COVID quite mildly, but then live with these symptoms for a long time. And I think in particular, and this is what none of our experts could really tell us much about, why it sort of has an impact on our mental faculties as well. Tell us a bit about that and how that presents for you.
Well, similarly to what Zaz was saying, I have real problem with the sort of brain fog and the word finding. So I'm talking to you now and I appear to be, all intents and purposes quite normal and having a conversation. But I'll be halfway through a conversation and I just won't be able to find the word, or it'll be a similar word, perhaps with the same start of the word, but I can't quite find it. And it reminds me of when I was, looking after stroke patients and they would struggle to find the word. It's just like that. And also, I have a very busy job and I'm supposed to be able to multitask, lots of things. I find that really difficult to do now. I find I can only do one thing at a time. And I can't listen to something and be writing something else down and be able to do both. And I can't concentrate for really long periods of time without just getting really, really tired. And so meetings, for example, where I'm talking or we're talking as a group for long periods of time, I'm absolutely exhausted afterwards. And they don't seem to know why we're left with this. I mean, I'm having a number of investigations to see what's going on, but I'm really not sure they're going to find anything.
And is there any kind of treatment or recovery practice that's helped at all?
Well, I have had. So during the year, I was ill. March 19th was my anniversary of when I got it. I was ill for 5 weeks with COVID and then pneumonia, and then a week later, I'd gone back to work, and then it was just too much for me, and I went off work in June. And at that point, I'd actually started having panic attacks as well, and flashbacks to when I was sick. I just found it impossible to sort of cope with life, and I actually was given some very good help there by my trust. My occupational health department had a therapist who was able to provide some specialist PTSD, specialist therapy for helping me with that. And so that really helped me get through a period where I was very depressed and really finding it very difficult to function apart from, basically looking after my children. So the counselling was great. From a point of view of the memory function, I don't think, I try. I'm working again. I'm full time again since December. But I have to take things very slowly, and I have to take regular breaks. I have to manage my energy. I have to pace myself, which can be very hard when you're in a busy job. And we've got 2 children.
Well, quite. I don't know how you do it. And I just wish you all the best and hope that you continue to see improvements, even if they're only baby steps. But thank you so much for talking to us this morning, Sasha.
Thank you. And may I just say quickly hello to my sons, Thomas and Jack. So I promised I'd mention them on the radio. So thank you very much.
Of course. Hi, Thomas. Hi, Jack. Have a good day. All right. Take care, Sasha. Thank you.
Thank you.
Sasha Pearce, physio, NHS manager, mum of 2 and long COVID sufferer as well, battling through that at the moment, and 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 through that at the moment.